We didn't know that was even possible. Every time that we went back to treatment, there was another improvement. So each time he speaks better, he initiates more communicational language, and eventually he starts improving on life skills. Eye contact started appearing, and he started looking for hugs and kisses. He's improving in communication skills so much that maybe he will be more independent. The treatment keeps becoming more inclusive, more progressive. So far, we're seeing improvement after every treatment. That's why we went for the 6th time.
How often have you visited us for a stem cell treatment?
Okay. So we started in 2019, March 2019, and first we did every 6 months. Then, because of the COVID pandemic, we had to take a break, and then we started to do every year. And this is actually our 6th time at Swiss Medica. But we've also done for 3 children. So in total, we've done today 11 treatments, including 2 treatments that we did in a clinical trial in Israel with cord blood. So 9 treatments at Swiss Medica.
And can you please describe the condition of your child before the first treatment and how it's manifested after each treatment until now?
So first we have Dolev. He's my eldest child. He had drug-resistant epilepsy, and he had he was nonverbal autistic. He did speak words that were not functional. So he would count numbers until 100 in Hebrew and in English. He would recite the ABCs in Hebrew and in English. Things that come in shapes or farm animals, things that come in categories. So if he would watch YouTube a lot, and he would get a new category to recite. There's no functional language. No, I want is not something that it doesn't say dad, it doesn't say mom. And also with his epilepsy, before the first treatment, it was very bad. He would go to the ER maybe once a week, maybe once a month. Depends on how well a new medicine works. So with anti-epileptic medicine, you have something called the honeymoon stage, where after you take the medicine for the first few months, maybe the medicine will be very effective and you won't see so many seizures, but at some point it stops working, and we would switch different medications. I think we went up to 6, maybe 7 different medications, and he had 10 absent seizures a day. Absent seizure is when you just stare into space and you freeze. Or every once in a while, every few days, he would have a tonic-clonic seizure where he falls on the floor and starts spasming, and maybe even lose consciousness, maybe even stop breathing. So it was a very bad condition before coming to treatment. We went to treatment because the condition was so bad that we were told he was probably not going to survive the treatment. He will probably not going to survive the epilepsy. It will probably kill him before he reaches age 6. So we had this kind of time that we had to reach before age 6 to try to help him in any ways. We knew stem cell therapy could help with autism, and we thought maybe if it starts speaking functional language, maybe if it starts using a tablet or picture cards to show us how he feels, then we will be able to help him avoid brain damage. If he falls down during a seizure, and he tells us that he feels like a seizure is coming on, we can put him somewhere on the floor or somewhere soft where he won't hit his head and will be safer. Fortunately for us, once we arrived at Swiss Medica for the first time, We were told there's a chance it might help with epilepsy. We didn't know that was even possible. We were very surprised, and we were even more surprised about 2 weeks after the treatment, where we realized we haven't been seeing daily seizures at all since the treatment. So instead of 8 seizures a day, there were zero seizures for the last 2 weeks, and language started coming more clearly, more functional. A week after the treatment, he stood in front of McDonald's, he pointed, which is something new, and he said, "I want a meal with hamburger and french fries." And this is a kid that maybe said, "I want," if you tell him that he has to say it in order to get what he wants. And this is him saying it from himself. This is maybe the first time that he understands that in order to get the meal, he has to use his words and say functional language in order to get what he wants. So that's about a week after we came back from Swiss Medica, back to Israel. And slowly there's more functional language, slowly there's more improvement for motoric skills. He was not a very stable walker, and then he started walking more stable and climbing better, and so there's improvement for other areas that we didn't know would happen. And eventually we took him off of anti-epileptic medication, so he's been improving a lot. And that's just after the first treatment. Afterwards, there's no seizures since then. We went back to treatment to get more improvement for communication skills. So each time he speaks better, he initiates more communicational language, and eventually he starts improving on life skills. He starts to wash himself and clear the dishwasher. He tries to load it now. Every time that we went back to treatment, there was another improvement. So we said we have to try again. And that's how we came to six treatments for Dolev. For Nevo, this is his second treatment with Swiss Medica, and he was verbal before. He was functional before, and it was very confusing if he has autism or not. Some of the people that diagnosed him were not so sure, and some of them were very sure. My wife was very sure. I thought of autism like how I saw it with Dolev, so for me it was confusing too. And then after he got diagnosed, it was very clear to me that it was indeed autism. So he's what some people call confusing. And for him, after he got treatment, suddenly he's talking less in circles over the same topic that doesn't really make any sense. It's not interesting for anybody. He's more interested in what other people have to say in the conversations. The children in his school suddenly had names. Before that, it was that kid did something to annoy me. I played with one of the kids in class. They didn't have names. Suddenly they have names. That was, for me, a very clear sign that the treatment is working for him as well. It's different because I have Dolev, which doesn't speak at all, and Nevo, which does speak, but he has some other issues. So we're hoping for now to see better ability to delay gratification. He gets angry very quickly. Hopefully maybe that will improve, or maybe something else to do with understanding social situations, which has improved the first couple of times. So we're hoping for more improvement on understanding social situations. He doesn't understand when somebody is doing something that has nothing to do with him, that this is something that that is not related to him, sometimes he gets angry because of that, because somebody will play with a game that isn't his game, and for some reason he takes offense. So we're hoping that's something that's going to change as well. And then there's Dov, my third child, who was very similar to where Dolev is, epilepsy and autism. He doesn't speak at all. He went through one treatment, and this is his second stem cell therapy. And we're hoping that words will come. He doesn't even have language like Dolev did. He doesn't have any sounds at all. He just hums every once in a while. Maybe he says ba or something like that. He's nearly 3 years old. And he should have some language. He actually had a regression where words disappeared. He would say tata for grandma, and whenever grandma would call on a video call, he would say tata 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 for grandma. And we're hoping that words will come back. He had a very bad regression. His last EEG before the treatment showed that he had brain damage, epileptic encephalopathy, because of the seizures. So he had very bad. He went into a very bad condition, and he's not even as old as his brother was at the same level, or even worse for epilepsy. More seizures a day. He went through more different types of medication to try to help him. And then he hasn't had seizures since his treatment as well, which is very nice. And now we're hoping for more improvement on communication skills. Language maybe will come back. He has better eye contact than he had before. He has better communicational body language gestures than he had before, and now we're hoping also for improvement in that, and also improvement in language.
Do I understand you correctly that Dolev, your son, had 6 time of stem cell treatment, right?
6 times. This is the 6th time.
6th time. Yeah, and between each of them, have you noticed any kind of improvements, or you have noticed significant improvement only after the first time, second time, but less after the third time, fourth time?
Yeah, it's less dramatic each time, because the first time he wasn't really speaking, and then he started speaking. In order to be more objective, we're also doing an online assessment called the ATIC test. And in this ATIC test for autism, you fill in the questionnaire, and you get a score between 180 for severe autism to 0 for normal. And he went, at the beginning it was at 149 points, so very low function. He went to 110, so about 30 points, closing the gap. And then he went to, I think 80, something like it. So again, 30 points. And each time he closes 30 points. So it's about the same kind of improvement. And then later it goes from, like right now, the last time we tested, he was 18, 11 points, something like that. Usually children with autism that don't do these kind of treatments, they go down to 30 points naturally. But so we went below the 30 points group, and he went down to 11, and so from 11 points, maybe it's okay to stop, because we know stem cell therapy doesn't cure autism. He will always be autistic. But he's improving in communication skills so much that maybe he will be more independent. Maybe he will be able to work at a job. Maybe he will be able to have a relationship with another person, or have friendships. Today he has trouble making friendships in his group, which is he's in a class with 7 other autistic children. So it's children that are similar to him, and he's having trouble making friendships in that group. We're hoping that this is also going to help him understand that friendships, how to make friendships, how to maintain friendships with other children his age. And here we have a chance to maybe, when he becomes an adult, to, instead of sending him to a home for autistic children, for autistic adults that will take care of his needs, we have a chance to maybe keep him at home while he goes to work and he goes to have dates maybe with women or men if he chooses to. We're not judging anybody, and we're hoping just for him to be happy. That's what we want. We want him to be happy. We don't want him to go to a closed hostel for autistic people, because those places are scary. You don't know who is going to be taking care of your child, and we hear stories where not all of the people are getting good treatment, and we really don't want to be afraid that we're sending him to be taken care of in a place that doesn't actually take care of him. Here, if we're doing these kind of treatments and it helps him achieve independence, at least to a level that is possible for him to receive, then we are feeling a little bit better that somebody is taking care of him after we are gone. Maybe his siblings will take care of him. Maybe even Navon, who's also autistic, but he is at a better verbal functional level than Dolev. Maybe he will be able to be independent enough after these 3 treatments as an adult to take care of his older brother. We're not sure where Dolev will end up. Maybe he will be able to take care of himself. We don't know. We're hoping, but we're not that optimistic about it. But we do know that right now, with the level of independence and functional language that he's gained, that it seems like he will be at least safe. Safety is very important. So that's what we're getting.
Mm-hmm. Do you think it is important to engage with your kids after the stem cell treatment to add some additional benefits, let's say like that, or it's okay to skip them?
No, it's very important. It's very important to learn how to be a parent to a child with special needs, especially with autism, where you have to teach them how to be independent. Last year, Dolev started taking showers on his own after the treatment. Before that, he didn't understand how to do the actions. It was very hard to teach him. But we're taking this extra time to teach him to go through the different stages of washing yourself in order for him to be independent. So he goes into the shower and he opens up the water, and he forgets sometimes to do the actions. So we remind him. But every time where he makes an improvement, he will be more independent in these kind of actions of self-care. And the more self-care that he has, the more independent he will be later on in life, where he is an older man and he needs to take care of himself or needs to help somebody take care of him. So he is now struggling with sitting in class and learning academic skills. He is struggling with social skills, making friends. He is struggling with independence of making himself a meal and making himself getting dressed, and there's a lot of things that he still struggles with. But in order for him to succeed to learn these skills more easily, because he has stem cell therapy, we also have to work with him. So it is very important, as we see it, as my wife has taught me, that I need to work with my kids with whenever there's an opportunity that he wants to do something and he can do it maybe independently, I need to allow him to do that, to be independent. And I also need to be there to give him the guidance that he needs in order to do it more independently and more correctly. And that's why I also learn all the time from I take courses how to work according to ABA, or according to DIR, or according to these different methods, how to work with autistic children. So it's also very important, if you can get the time and the money into educating yourself as a parent, it makes the treatment more effective. It doesn't come separately. You try these, you try to work with your child and it doesn't work, or you try to do stem cell therapy and nothing happens. It's probably because you need to combine both of these things. You have to have a speech therapist, an occupational therapist, and you have to have time with your kid yourself to work with your kid in order to get them to learn new skills, because that's what the treatment does, as far as I understand. It gives your child a chance to learn new things, so you as a parent have to be there to teach him after you give them the medical treatment.
Have you noticed that the impact of cell therapy lessen over time?
If the treatment lessened after time, I think it's really hard to pinpoint if the stem cell therapy is less effective. It is definitely less dramatic every time, because the first time you have no seizures, you starting to speak, it's a lot easier to understand where he was before and where he was later. But from after the 5th treatment, it's from not showering himself, only his parents watching him, to showering independently or with guidance. Like, I don't shower him physically myself. I tell him, use the soap, and he does all the actions himself. This is something that's it's less easy to compare. It's hard to compare these hygiene skills to verbal language skills. It's not the same. So maybe it is lessened, maybe it isn't. It's really hard to compare after each treatment if it was less or not. So far, we're seeing improvement after every treatment. That's why we went for the 6th time.
Yeah, I wanted to know whether, for instance, you get an improvement, and does the child get back to the previous stage over the time?
Okay.
Yeah.
So for Dolev, there was never a regression that was completely back to where he was. What we would see was that he will improve and then stop talking, stop taking care of himself a little bit. There was like some kind of going back, but it was for maybe a week or maybe 2 weeks, and then he would continue from where he was before and continue to learn new skills, new language, new everything, improve in motor. So it wasn't a regression. It was like a stopping to gather up resources for continued learning. For Nevo, for example, for him at the beginning, we didn't really see an improvement. And then after 3 months, we suddenly saw these changes. For Dolev, it was right after treatment. For Nevo, it was 3 months where he was very hyperactive. It was difficult to deal with him. That's also something we're hearing for a lot of other parents, that they were very hyperactive after treatment, and then there should be some improvement. Not for everybody, but for my children, all of them had improvement. So for Nevo, as I said, he had 3 months where he was not really improving, and then he had a few months where he was improving a lot, and then it calmed down. So it's not an effect that stays forever, but it does have a dramatic effect. That because we're writing everything down that changes, when we look back in the notebook, then suddenly we understand the dramatic effect. This is also something that we learned after Dolev's first treatment. If you don't write it down, you don't remember anything. It seems like there's nothing changing unless you look in the notebook. Once you look in your notebook and you see today he said this sentence, and before that the sentence was not so complex. Now his sentence has more elements of language that weren't there before. So the only way to see that this is a dramatic improvement is if you write it down in a notebook. So for Nevo, there was really stages where he wasn't really making a huge change, but he didn't go back to how he was before the treatment. He did have an improvement, and then it slowed, and then we went to another treatment. So we had this period again where there's not really a lot of changes. He's very hyperactive, and then after 3 months, give or take, he starts progressing in language and communication skills and so on. And for Dov, my youngest, he was so seizures stopped. That's the first thing we obviously saw, and then eye contact started appearing. There was zero communication with him before. It was like a vegetable. So eye contact started appearing, and he started looking for hugs and kisses. Kisses came back. There are a lot of things that are communication, that skills that you take for granted when you have a child with special needs that can go away. So he had a big regression before the treatment, and then the treatment stopped the regression. He was only going downhill, and then he stopped, and he started to gain some of the communication skills, basically everything except language. Unfortunately, language is not something that has come back yet. We're hoping that it will this time. That will help. We're probably going to come back for more treatments for Dov. Yeah.
Since we introduced exosomes, and as far as I understand, for the first 2 or 3 times you haven't tried them yet, right? Exosomes.
Yeah, the first 3 treatments, they didn't have exosomes, so we only started them in Dolev's 3rd treatment and Nevo's 2nd treatment. It was hard to say at the beginning if they have a special effect compared to doing treatment without exosomes. Stem cell therapy was very effective without exosomes for Dolev, for Nevo as well, and then the effect, it seems the same for Nevo and Dolev after they started getting exosomes as well. It's really hard to say if they had a big effect. What I can say is that we did give Dov some exosomes. I don't know if I'm allowed to say this. We did give Dov some exosomes after his first treatment, which he was not given on record. Somebody gave us, we gave him some extra exosomes, and then we could see an effect that was clearly exosomes because he was very very after the cord blood treatment that he got in Israel, suddenly he's getting like half a year after the treatment, he's getting exosomes, and suddenly there's this extra boost. So after we did that, we realized that the exosomes are actually affecting Dove very clearly. And he's also hyperactive, which he hadn't been for a while, and he's also getting more communication skills, better eye contact, and better mimicking. He copies what other people do with their hands more. So we do know that it does have a very significant effect, but it's really hard when you come for the treatment and you get exosomes with the stem cells to say which one is giving a good effect. We can't tell like that. But because we did a little bit apart, then we know that it does have a good effect.
Yeah, do I understand you correctly that you took exosomes separately from different type of treatments?
Yeah.
I mean, cord blood and stem cell.
Dove had cord blood.
Yeah.
We saved his cord blood when he was born. And then he was deteriorating from the epilepsy. It was a very violent epilepsy that wasn't responding to medication until our doctor in Israel said, okay, we're going to give him the cord blood. I don't care what the hospital tells me, and I'll get the approval. And he got into a lot of trouble because of it, but eventually it was okay. He's in the administration as well, so it's not that he wasn't that worried about it. But some of the other administrators were angry with him. But he got approval to give Dove his cord blood when he was 2 years old almost. So he got it in October 2022, and he was born in November, so he was nearly 2 years old when he got his cord blood. And that stopped the seizures and had a very good effect on communication. And then we got exosomes in April, just exosomes in April, and we gave him the exosomes, just the intranasal spray, and he suddenly started improving some more energy, more hyperactive, but also improving in communication skills.
In your opinion, what makes our clinic stand out?
Really, what we see from other clinics, because we do know a lot of other clinics, is that this place has first of all, it has a lot of like research. You see that the treatment here is changing over time, and the doctors are reading research that is happening around the world. They're not like static. Because, for example, there's a clinic that's very famous, and you see that the treatment hasn't changed in the last 20 years at all. And Swiss Medica, we've been here 4.5 years, and it kept changing the treatments, and it keeps adding more without changing the price. It's nearly the same price that it was 4 years ago, and it keeps adding more, the exosomes, more stem cells, 2 injections instead of 1. The treatment keeps becoming more inclusive, more progressive, innovative, and that's one thing. And the second thing that we really like about this place is that you get accommodations included. You come here, you get boarding, you get meals, you get everything taken care of, transportation from the airport to the clinic to your hotel. If there's a driver available, they'll even take you to town to get to do shopping, and you don't have to break your head, where am I going to get maybe Airbnb, maybe a hotel. I know that other clinics don't include this, and this is something that's really comfortable about choosing Swiss Medica, that you don't have to break your head on where you're going to take care of all these things that you need. And you have laundry service and everything that you basically need. 3 meals a day. It's really nice, and the medical team is very nice. Very, we're coming here with children, and they're very happy to see the children and playing with them and being very nice toward children. They're very patient with children. It's very nice that you have the doctor speaks with the child at eye level, doesn't talk over their head, so the children feel very comfortable here. I think that's something that, yeah.
Mm-hmm. Is there any advice you would like to share with parents who might be considering stem cell treatment?
Advice for other parents. So first of all, you should make sure that you include all the medical documents for your child. You should do whatever blood tests your doctors in your country are recommending to do. You should be prepared to consult with the doctors here at Swiss Medica and see what they have to say. I know Swiss Medica doesn't accept everybody for treatment, but they are able to treat a lot of different conditions. So it's very, very easy. Also, if you're a parent to a child with autism, then you need to make sure that you have, the education that you need in order to make sure that they progress after the treatment. So you do need to work with your child on independence skill and communication skills, and you need to buy toys so you can work with your child on how to do certain things or react in certain social situations. If your child has motor skills like from CP or something like that, then you do need to have physical therapy. Movement therapy is good for everybody, even children with autism. We're talking about a communication problem, but it's a very holistic problem. It's not just communication. They also usually have motor skill problems. They have the sensory processing issues. So you also need to make sure that they have, the shirt that is comfortable for them, a heavy blanket, working with the occupational therapist on sensory issues. So it's not just stem cell therapy. You come and you do it. No, you have to do all the work around treating your child. And the medical intervention is important, but it's not the only thing that is going to make your child progress. You also have to do, the notebook. Make sure that you write everything that happens so you can actually see if there's success or not. If you don't write it, it doesn't feel like there's success, even if there is.